Welcome to Morning Grounds, Morning Rounds, the series where we highlight the people, partnerships, and ideas shaping the future of Stony Brook Medicine. Today, we're discussing a topic that helps make our mission possible, the power of giving. Stony Brook is a public institution, but much of what makes our care exceptional, from cutting-edge technology to patient support programs to groundbreaking research, depends on philanthropy. Associate Vice President for Advancement Danielle Holton joins us to share the impact of generosity in all its forms. Small monthly gifts that add up to big change, families honoring loved ones, grateful patients hoping to help the next person in line, and major philanthropic partnerships that reshape what's possible in healthcare. So, grab your coffee, settle in, and let's get started. Thank you so much for joining me today, Danielle. It's a pleasure to have you here.
Thank you for having me.
So let's start off with, maybe an obvious question. We're a state institution, and many people assume that donor support isn't essential. How do you communicate to potential donors that they really can have an enormous amount of influence?
I often say that being a public institution means that we have a responsibility to serve everyone. But it doesn't necessarily mean that the state supplies us with all of the resources necessary to really deliver exceptional care. Philanthropy can be the conduit to provide things above the basic and really innovate change here. Mm-hmm. When donors hear that there is an opportunity to really invest in a variety of things, including patient care and research and capital projects, they then understand the impact they can have at Stony Brook Medicine.
So when you think about that impact that people can have, how do you see it making an immediate difference in, say, patient care?
I think when we think about immediate impact, we want to think about the areas that matter the most. So supporting a family going through a crisis, providing a patient care provider with innovative technology, supporting a research team on a promising idea. Those are the things when we can marry compassion and urgency, that's where those of us doing the work see an immediate impact, and we can share that information with the donors who were partially responsible for making that happen.
Makes sense. COVID must have been a great example of that.
It was. We really had people who proactively reached out to us on a regular basis, those loyal friends in the community who knew what was happening and wanted to do all they could to really serve as our true partner and help us in a variety of ways. Some of that was very general support, and some of it was for very specific things that we needed at that time.
Great. Now, one of the things that I think people sometimes are confused about is what's the value of a small gift? If you get somebody, the Jim Simons who give lots and lots of money. How do you have that conversation with people about the value of small gifts?
So we say that we are grateful for every level of support, and we absolutely mean that. Maybe it's best to share an example. So we had a loyal group of supporters who had become aware of a patient care team, and this was around COVID time, who were going above and beyond. And that was such a stressful time, and so much support was needed, and they wanted to know what they could do. And so they collectively contributed to a brand new fund, and it was for the wellness efforts of our patient care team in that area. And that fund allowed us to buy necessities and extras for that hardworking group of individuals. And it was something where the thought counted a lot, but the action behind it, and it wasn't monumental, but it absolutely made a difference in the day-to-day life of those working so hard. It let them know how much we appreciated them here at Stony Brook, but the community appreciation as well.
Yeah, that's very powerful. It's a great example. As you sort of think ahead to the next year, 2 years, whatever, what are some of the major giving priorities or things that are really at the top of your agenda?
I think we're always giving consideration to where philanthropy can advance excellence here at Stony Brook Medicine. So some examples of that is advancing cancer care, enhancing the behavioral health programs that we offer, coordinating a lot of the complex care that we deliver. It's great care, but sometimes what's lacking is that ability to coordinate and make it a little bit more of a seamless process for our patients and their families. And that's a clear example of where philanthropy can have a big impact. So, and then we are communicating that with those who are interested in hearing how they can help. And when they hear that and understand the influence and effect that they can have on the work we're doing, they often do want to help us in that way.
Great. Is there difficulty in sort of balancing some of the regular financial realities of the day-to-day operation of a health system with donor ideas, or asking them about giving gifts?
Sure. So when a donor indicates where an interest would be, we always want to match it with a current need. That said, I will tell you that we've had some generous community members step forward and present us with ideas that maybe weren't on our radar. And maybe the reason it wasn't a priority for us is because of funding.
Right.
And so when that funding becomes available through the generosity of a community member, it expedites that plan and potentially elevates it to the top of a list. We've seen that happen, and we're very grateful for that. And so we do welcome ideas, and whether that's something that's generated from a community member or marrying something at the top of our already existing list with their interest, we try to always work to find those matches.
Great. That's excellent. I wonder if you can talk a little bit about the donor relationship. When I have gone with you to see people, it always impresses me how carefully you cultivate those relationships and how really deeply caring you are of those individuals, which I think is very impressive. Why is that so important? Why is that so important to your work?
Well, relationships are at the core of what we do. And when I say relationships, of course, it's those who we interact with here at Stony Brook, but just as important is those relationships in the community. We prioritize them, we get to know them. I've been here for a long time, so it's been a real privilege to start some of those relationships and furthermore to maintain them. And that is what we're charged with doing. That's a real value that our team can bring. And we can serve as that front line with those individuals, and then bring them together with others at Stony Brook on a regular basis as appropriate. But we can serve that role of really managing, maintaining, and growing those relationships.
Does that translate into anything other than sort of a donation, do you think?
I think yes. So definitely we're grateful for the support that comes from that. But just as important is additional relationships that come with that.
Right.
So as donors get comfortable with us, trust us, respect our leaders, can speak on our behalf, that translates into them feeling confident to make introductions to others who might have a capacity to support us in the same way. So the better we do this job, the more individuals who we hope will consider supporting this work.
That's great. That's great. If you sort of look back at the last couple of years or even before, is there any particular gift that really stands out in your mind that you're particularly proud that you really helped seal the deal on?
Well, I would say a project more so than a gift. And while I'm proud of so much of the work that the team has done, probably what stands out is the Children's Hospital. I was recruited back when that project was just an idea, and I was asked to start working on it. So I started here at the ground level of that very important initiative. I was able to share the information we had at the time with community members to even gauge if there was an interest in supporting something like this.
Right.
And then I was able to be part of the plans as they progressed, and then sharing those plans with the community and prospects who might consider supporting it. And then we buckled up for the ride, which was seeing it begin, seeing it continue. And then ultimately, I will never forget the joy the day that we cut the ribbon on that project. And I stood there among the many donors who supported that project and had been with us from idea to the reality of that situation. So to see it from beginning to end and really grow such a community of supporters throughout that project was quite fulfilling.
That's fabulous. And such a great example. It's had so much impact and meaning for so many people's lives in Suffolk County and really all over Long Island. So,
And now that it's open, most of them, if not all of them, still remain engaged. We're not building another building of that magnitude, but there's so much other good work taking place within Children's Hospital that they continue to support and help us promote throughout.
That's great. Wonderful example. Thank you. What has surprised you most about motivations or values that drive people to make gifts to our health system?
So I think that I always knew people were good and generous, but getting to do this work every single day gives me a front row seat to see the general interest people have in doing good for others. And so whether that is in the form of a $10 donation or a transformational gift, it is real impact for real people, changing lives of what are strangers to them. I mean, it's a monumental shift in the work that we can do here. And it's just because of kindness and generosity and creating their true partnership with all that we do here for the healthcare of Long Island.
That's great. That's really wonderful. Let's talk a little bit about Stony Brook's eye care values. I think a lot of what you've described, it's very nicely into those values. How do you see those values relating to the work that you do?
We think about them a lot. It is really at the core of the work that we do, both when it comes to internal work as well as external. So I think that integrity speaks to really the stewardship we take very seriously when working with our donors, as well as the compassion. I think that when we think about compassion further, we think about how seriously we take the donor relationships and listen to what their needs are. I think the accountability speaks to how seriously we take doing with those dollars what the intention is and then reporting back so everyone knows that has taken place. And excellence really, I think, speaks to matching the donor's interests with the needs of the institution. And respect, I skipped, but I think that respect goes hand in hand with the trust that we build internally and externally.
I would agree. Absolutely. You can't really have one without the other. What do you, when you look over the next 5 or 10 years, how do you hope philanthropy will have played a role in the growth and development of Stony Brook Medicine?
I would hope we can look back and think that philanthropy was the spark that brought us to the next level. Obviously, we are doing more and more all the time. We're not slowing down. And we'll be able to look back and see that philanthropy really was a catalyst for new buildings, new capital projects throughout all of Long Island, research that has put us on the national map, patient care that is really at the cutting edge of what the trends are. So there's really an opportunity for us to think about all that philanthropy can do and hand in hand with what our leaders aspire to. And I think it'll just be continued excellent work together as a partnership.
That's great. And we have big aspirations.
Yes.
So that's good. All right. My last question really is, if you could send one message to the donor community, what would you want them to know and understand about the power that they have to change what we do here?
It would definitely be a message of gratitude and about the impact and the extent of the lives that are changed by the power of their generosity and kindness, the partnership that we have, working with them and relying on them and needing them to help us in this incredible work. This is a healthier community because of their work with us.
That's great. Well, thank you. And on the topic of gratitude, we are so fortunate to have you working with us in advancement, and we've been very lucky and look forward to years of future great work to come.
Thank you.
That wraps up today's episode. Thank you, Danielle, for sharing your insight and for the remarkable work that you do to ensure that philanthropy continues to elevate care at Stony Brook Medicine. Danielle's stories reminds us that every gift carries real meaning, and it is these contributions that ensure that we can fuel discoveries, lift up our care teams, support our patients, and bring life to programs and spaces that wouldn't exist without the generosity of our donor community. And to all of you across Stony Brook Medicine, thank you for the compassion you bring to your work every day and for inspiring so many to give back in ways that strengthen our mission. Until next time, keep the coffee brewing and gratitude flowing at Stony Brook Medicine.